We would like to add some clarification to keep us aware and informed during this period of time. If after viewing this presentation you should have any questions or concerns, please reach out to your regional property manager, regional facilities manager, or your area regional vice presidents. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Cover coughs and sneezes. Cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow. Make sure you throw used tissues in the trash. Immediately wash your hands. Also wear a face mask when you are around other people. Stay at home if you are sick, except to get medical care. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them. Use detergent or soap and water prior to disinfecting. To protect our teams, keep leasing and maintenance separate. If you need to discuss something, do it over the phone, through Teams, or via email. Keep 6 feet apart between you and your team members and our residents. When completing a service request, have the resident move to another room. What should you do to help every day? After you arrive, do a ground sweep. At each building entrance, wipe doorknobs, handles, and all touch surfaces with disinfectants. This includes elevators and trash rooms. Do this up to 3 times a day. At your shop, wipe down doorknobs, handles, and all touch surfaces with disinfectants. This includes bathrooms and eating areas. Complete your make-readies as usual. Complete your interior and exterior tasks. All emergency service requests where an occupant is suspected or has tested positive for the COVID-19 should be directed to your RFM. What has changed? Face masks should be worn at all times. There are several types available: paper dust, paper surgical, cloth face coverings fashioned from household items or made at home are acceptable. These masks are intended to stop the spread of infection from the wearer. Paper masks can be reused and should be replaced when they become soiled or torn. Cloth face coverings can be reused and should be laundered on a regular basis. N95 respirators are intended to be worn when completing emergency work orders. Maintenance teams must not be entering the office or sharing a break room with the office personnel. Work smart. Please communicate using Teams, via email, by phone, or outdoors, staying at least 6 feet apart. We cannot take the chance that either leasing or maintenance may infect the other. When a package is received, it should be sanitized and only opened when you are wearing disposable gloves. Here are a few things that we should be doing. Stay at home if you feel sick. Practice social distancing. Stay at least 6 feet away from others, even your team. Conduct meetings in open spaces. Limit how many people are in the shop together. Place orders for PPE, cleaning supplies, and toilet paper to keep your property stocked and prepared. Use PPE, gloves, mask, and eye protection. Wash your hands regularly. Use hand sanitizer regularly. Disinfect your tools. Disinfect mail and packages when they arrive. Wear gloves when unboxing and opening. Cover your mouth with your bent elbow when you cough or sneeze. Clean and disinfect high-touch locations daily. Complete emergency work orders. Follow guidance from your service manager. Complete the work in vacant apartments and limit 1 technician per make-ready unless social distancing can be achieved for the entire make-ready process. Complete exterior and common area work. Let your service manager or property manager know if you have direct contact with someone that has the virus. Call your regional facilities manager or regional property manager with any issues and/or needs. Don't come to work if you feel sick. Don't ride together in trucks or golf carts. Do not hold 8-minute meetings face-to-face. If necessary, use group calls or meet in an outdoor area where social distancing can be practiced. Do not hold property manager or service manager meetings face-to-face. These should happen in Teams or over the phone. Please don't go into the leasing office, no matter who asks you to. Don't meet with contractors or vendors face to face. The phone is your friend. Don't crowd the shop. Do not touch your face, mouth, nose, or eyes. And please do not talk about residents' or employees' health conditions with anyone. Now please take a few minutes to watch the following video on how to safely don and doff your face mask.
In this video, we are going to discuss the proper use and reuse of face masks. When donning your face mask, you will first perform hand hygiene. When you are ready to don your mask, you will pick it up and place it over your face, making sure you cover both your mouth and your nose. If you have a tie mask, you will first tie the top tie. Once the top is secure, you will tie the bottom tie around your neck. Once the mask is tied, you will gently pat the bridge of your nose so the mask forms to your face. When donning your procedure mask, you'll place it on your face and loop it around each ear. Then you will gently pat it around your face to form it to the bridge of your nose and pull it under your chin. Before removing your mask, you will perform hand hygiene. You doff your procedure mask by unhooking it from your ear. When you are ready to doff your mask, you will first untie the bottom strap, then you will untie the top, and you will place it on a clean paper towel labeled with your name. Be sure that the strings of the mask are not sitting inside the mask. If you're wearing a procedural mask, place it face down on your paper towel like this. Notice that the exterior of the mask is always facing down. This is an example of inappropriate storage of your face mask on your towel because the front of the mask is facing up. This image demonstrates inappropriate wear of the procedure masks. Procedure masks should not be pulled under the mouth or on the chin. You should also not wear your mask around your elbow or any other body part. The surgical mask should never be worn hanging from around your neck. If you determine that you need to remove your mask, you need to completely remove it. It should never be halfway on or halfway off. If you need to place your procedure mask in a brown bag, make sure your brown bag is prepared, labeled front and back. After performing hand hygiene, you'll remove your procedure mask and place it in the brown bag, ensuring that the front of the mask is facing the front of the bag. You will want to ensure that the brown bag is open wide enough to place your mask in without contaminating it. This is an incorrect way to place your procedure mask on your brown bag. When you remove your procedure mask to eat or take a break, make sure you still are maintaining your 6 feet of social distancing. This includes break rooms, cafeterias, or conference rooms. If you are unable to maintain your 6 feet of social distancing, you will need to consider using another room.